Hello and welcome to our special show. I'm Gargi Rawat. Diabetes awareness and prevention is always a hot topic of discussion among us, but what about pre-diabetes? A good understanding of pre-diabetes is essential for our overall health. As pre-diabetes cases continue to rise in India and around the world, promoting pre-diabetes awareness is essential. Raising awareness of pre-diabetes and stressing the importance of people knowing their risk is critical, particularly now as the COVID pandemic has amplified the negative health risks associated with chronic health conditions. So getting detected with pre-diabetes provides you with a window to take corrective steps to reverse the condition. And how can you do that? Well, that's what we're going to tell you during this show. We have with us eminent endocrinologists who can help you understand and manage pre-diabetes better. We're joined by Dr. Jayaprakashsai, a consultant, Apollo Sugar Hyderabad, an advisor, SAC, Government of Andhra Pradesh. Dr. Ami Sanghvi, consultant diabetologist, Sanghvi Eye and Diabetes Care Center, Dahisar, Mumbai. And we're also joined by Dr. Navnit Agrawal, retired professor and head Department of Medicine, MLB Medical College, Jhansi. Thank you so much, doctors, for joining us on this very important issue today, especially since the focus is so much on health after the pandemic, and in fact we're still dealing with COVID. But Dr. Jayaprakashsai, I'd like to start with you. What are impaired fasting glucose and impaired glucose tolerance levels, and what is their importance in diagnosing diabetes, and what levels can help diagnose pre-diabetes?
Prevention of diabetes is a need of the hour, and diagnosing impaired fasting glucose, we can diagnose a fasting blood sugar between 100 to 125 mg per deciliter, and postprandial blood sugar between 140 to 199. We say impaired glucose tolerance. These both values we term as pre-diabetes are high-risk individuals, and it's very important to diagnose pre-diabetes because we can prevent diabetes or delay diabetes if we have early detection. So it is, even we have a HbA1c of a glycosylated hemoglobin of last 3 months an average blood sugar. If HbA1c is between 5.7 to 6.4, we label them as a high-risk individual as pre-diabetes. And with the current pandemic of diabetes incidence is going up in our country, and it's very important to detect pre-diabetes so that we know that early detection of pre-diabetes will help in preventing diabetic complications. Thank you.
All right. Dr. Sanghvi, now it has been seen that many young adults are getting diagnosed with pre-diabetes. So what is the reason for that? And is it due to the COVID pandemic? You know, because of the COVID pandemic, there's been a lot of emphasis on diabetes as well.
So first, hello all, and at the outset, thank you NDTV for having me for today's discussion on pre-diabetes. So it's like rightly said, you know, that every human being is the author of his health or disease. So when we're talking about numbers of pre-diabetes, yes, they are increasing. And as you rightly mentioned, following COVID-19 pandemic, we have seen a surge in cases of pre-diabetes and diabetes. So along with COVID-19, there are many other reasons why we are diagnosing pre-diabetes so much more in our younger individuals. Other reasons can be urbanization, erratic eating habits, erratic lifestyles, smoking, physical inactivity, and putting on weight, obesity, which is one of the very important reasons. Above all is genetics, because we are a high-risk community, high-risk race, where we are more prone to develop diabetes. And it's like, the genetics load the gun, but the lifestyle pulls the trigger. So lifestyle is the cornerstone. With balanced diet and good physical activity will help not only in pre-diabetic and diabetic patients for someone, but also for someone who does not have diabetes. So we need to start making them aware, as we are doing through your medium, through various other mediums, the importance of good lifestyle changes to prevent these chronic diseases.
All right, so important to keep in mind. And as you said, lifestyle is what really dictates how your health, what your health is like. Dr. Agrawal, when should people start considering testing or diagnosing pre-diabetes?
No, I'd like to say one thing, that pre-diabetes implies that a person who is pre-diabetic will inevitably land in diabetes. So since this is not true, so many people would like to call pre-diabetes as an increased risk for diabetes, and others would like to call it an intermediate hyperglycemia. Now, why do we want to screen a pre-diabetic? The reason is that many pre-diabetics are asymptomatic. Number two, studies suggest that pre-diabetics may be present up to a decade before before you develop diabetes. Number three, some individuals with type 2 diabetes may have one or more diabetic specific complications at the time of diagnosis of diabetes. And if we diagnose these people early, then we can alter the natural history of diabetes. The diagnosis of pre-diabetes should therefore spur efforts for control of diabetes in that individuals. And when to screen? All individuals above the age of 45. ADA recommends that all individuals above the age of 45 must be screened, or if the gentleman is overweight, then even before 45 he should be screened, or is having a family history or risk of diabetes like hypertension, dyslipidemia, a woman who is having gestational diabetes, or who have evidence of cardiovascular disease must be screened.
All right. Now coming back to the sugar levels, Dr. Jayaprakashsai, if a person's random sugar is above 140, does this then indicate that he or she may have pre-diabetes?
So if a person has a random blood sugar more than 140 mg per deciliter, if it checks with a glucometer, I think it's better to reconfirm with a lab test. And there is nothing to panic if a random blood sugar more than 140. He has to go and get a lab checked and see that his blood sugars are below 140. If he has more than 140, the prime important will be on lifestyle modification, which will help in preventing diabetes, because it's very important to have early screening and detection of diabetes so that the patient can change his lifestyle, because diabetes is not a disease, it's a lifestyle disorder. So that if he changes his lifestyle modifications, like nutrition is a key management in prevention of diabetes. So nutrition will work as a medicine, and plus exercise. 30 minutes of walking every day will prevent diabetes by 40%. And if he maintains this, keeps sugar levels under control, and he checks after 3 months, and if the readings are going up, then needs a medication. I think the prime important will be more of a lifestyle changes, which is more prime important will be a diet plus physical activity and stress management. I think yoga and even simple exercise like Surya Namaskar also will help in stress management. So the key management will be identifying the risk as well as delaying or preventing diabetes. Thank you.
All right, Dr. Sanghvi, now if left untreated, if you don't detect the pre-diabetes and it's ignored, how long does it then take for pre-diabetes to progress into full-blown diabetes?
So if we try to understand, see, the numbers of pre-diabetes are constantly rising as the number of patients with diabetes is rising. So back in 2013, the global prevalence rate was 7% of pre-diabetes, which is estimated to go up to 8% by 2035. Any patient who has pre-diabetes has a chance of developing full-blown diabetes, or 50 to 60% chance of developing full-blown diabetes in his lifetime. Every year, 5 to 7% of our pre-diabetic population turns to full-blown diabetes. So, the risk factors which Sir just mentioned, any person who is overweight, or who has hypertension or cholesterol, or who's undergoing a lot of stress, or he's having some infection, or being given steroids for some reason, or having gestational diabetes, this population may develop diabetes a little sooner. Okay, so if we identify this high-risk population at the correct time, give them timely help, maybe we can prevent the progression to diabetes. At least if we can delay it by a few years, it helps them in terms of being, having less complications, and even not going on medications if they follow the correct lifestyle changes being advised to them.
All right, now Dr. Agrawal, how can someone with excess weight and pre-diabetes then reduce their risk of developing type 2 diabetes? What kind of changes do they now need to make?
There are two components of this answer. One is nutritional recommendations. What are the nutritional recommendations for controlling pre-diabetes? And the second is increase in physical activity. Now, as regard nutritional recommendations are concerned, leguminous vegetables are very important in the diet. Then fruits which have a low glycemic index, whole grain and low fat dairy products, they are the mainstay of the diabetes diet. Then as regards fat are concerned, increase in monounsaturated fatty acids is the primary method of controlling diabetes or pre-diabetes. The protein intake should be about 1 gram per day. This is the standard teaching. And as regards carbohydrates are concerned, sucrose can be taken provided it is within the normal calorie framework, and sugars with low glycemic index are preferred. Fructose is preferred over glucose. As regards physical activity is concerned, physical activity is important because exercise reduces the cardiovascular risk, it reduces systolic blood pressure, it reduces body fat, and it also helps in reducing weight. So exercise again is of two types. One is aerobic, the other is resistance exercises. In aerobic exercises, 150 per minute per week. So 150 minutes for every week is essential for maintaining good physical activity. And what does 150 minutes means? That you must walk 3 kilometers per day in half an hour. So 10 minutes per kilometer. That is a vigorous activity. As regards resistance exercise is concerned, then weight dumbbells. Dumbbells are very good, but if you don't have dumbbells, then you can make do with bricks. So many people use bricks to develop their muscle tone, and this increase in muscle tone will help in reducing or increasing the calorie expenditure. And finally, the person must be asked to reduce his sedentary behavior. If he is sitting, for example, a bank clerk sitting for 4 to 6 or 8 hours, then he must be advised, look, you stop sitting for so much, every 1 hour, you must keep on walking for a minute.
All right, so important things to keep in mind, even for all of us who, are in offices and sit for long periods. Dr. Jayaprakashsai, so we just spoke about, exercise and all, but what is the best way to manage pre-diabetes, and are medications compulsory to manage this condition?
I think this is a very important question you asked, because currently diabetes is a healthcare tsunami. And we see that a lot of youth are developing diabetes currently in our country. I think we need to focus on early screening, and because from pre-diabetes to diabetes, it will take 3 to 5 years. And during this COVID pandemic, we have seen there is a full explosion of diabetes within a span of 2 years. I think a proper sleep and exposing to sunlight and making these dietary changes, because which includes more fiber take. We take a lot of refined foods, a lot of carbs we consume. I think if you manage changing a dietary regime as well as exercise, we'll have a prevent further so that we can prevent diabetic complications. The key aspect of detecting diabetes early is that we can prevent diabetic complications. So overall is a lifestyle modification is the key in prevention of diabetes. So let's act all together to fight against diabetes. So act now, prevent diabetes.
All right, important to keep in mind of maintaining our health and, being aware of the risks, especially of diabetes. We'll slip into a short break now and return with more questions for our panel of doctors. Do stay with us. Welcome back to our special show where we're discussing diabetes and pre-diabetes, which is a condition that many people suffer from, but you do have a window to take certain steps to improve your health and prevent it from developing into full-blown diabetes. Well, let's go across to the doctors who are answering all our questions. And Dr. Sanghvi, my next question is to you. Should people with pre-diabetes avoid certain types of exercises? We do know that exercise is important for your health, but which are the safe exercises for people with diabetes?
So as sir rightly mentioned, the guidelines also say that 150 minutes of exercise every week is what is been recommended, but this may vary from individual to individual. If you have some complications due to diabetes or some comorbidities where there may be some restrictive form, ideal would be brisk walking or some moderate intensity exercises. But if you have certain issues where you cannot do these exercises, maybe you can get in touch with your treating doctor, take the correct guidance and ask him how to go about with the physical activity. And now, why do we insist with physical activity? Is because it helps in weight loss. So every 1 kg weight loss helps to prevent diabetes by 16%, and every 1 kg increase in weight leads to increase in risk of diabetes by 4 to 5%. So something about, if you bring about a weight loss of say 6 to 7%, which is like achievable, sustainable, you can delay the progression from pre-diabetes to diabetes. And earlier Dr. Sai also mentioned about yoga. Yoga can be incorporated in a daily routine because it not only helps to bring down the blood sugars, but other comorbidities also. If you have blood hypertension or cholesterol issues, it helps to alleviate stress and bring about a lot of positivity. So with the right guidance with your treating doctor of what is the right physical activity, some amount of yoga, I think you are on the right track to prevent from progressing from pre-diabetes to full-blown type 2 diabetes.
All right. Now, Dr. Agrawal, if you could just help us understand, the terms glycemic index and glycemic load. What exactly, do they mean? And in deciding the daily diet, how important are these things?
Now, this is a tricky question. I mean, it is difficult for me to make you understand within 1.5 minutes, but let me try. See, glycemic index is a system of assigning a number to carbohydrate containing foods according to how much each food increases blood sugar. Now, what is the meaning of this? The meaning is that you give 50 grams of oral glucose, and after every half an hour, you measure the blood glucose and you draw a chart. Now, you give a carbohydrate containing food, say for example, rice, say for example, mashed potatoes, and you give 50 grams, and then you again draw a chart after measuring it every half an hour in that individual. You superimpose the two graphs and you look at the area under the curve and multiply it by 100. Now, it is not easy for a layman to understand what I am talking, but the idea is that how much glucose can be extracted from that particular food, that is 50 grams, vis-a-vis 50 grams of oral glucose. So the difference, or the area under the curve multiplied by 100, is glycemic index. Now we divide glycemic index into 3 types: low glycemic index, high glycemic index, and in between or intermediate glycemic index. Low glycemic index means less than 55, and high glycemic index means more than 70. The rest is intermediate. So foods like oat, barley, parboiled rice are low glycemic index foods, whereas food like naan, cornflakes, and white bread, they are high glycemic index foods. And intermediate is, say, basmati rice, rice puffs, and white roti, and some whole grain roti is intermediate glycemic index. As regards fruits are concerned, apple, pomegranate, and pear, grapefruit, oranges, these are low glycemic index fruits. The high glycemic index fruit is watermelon and overripe banana. Banana is one fruit which you can give. If it is less ripe, it is low glycemic index. If it is fully ripe, then it is intermediate glycemic index. And if it is overripe, then it becomes a food of high glycemic index. Skimmed milk and yogurt, these foods are good because they are low glycemic index foods. Now, what about the aim should be that the diet should contain low glycemic, as far as possible, low glycemic index carbohydrates. What is glycemic load? Now, it is all right to understand that a particular food has a glycemic index of 50. But supposing one gentleman takes 100 grams, another gentleman takes 200 grams, another gentleman takes 300 grams. So the amount of carbohydrate that can be extracted from this food will vary. And this is called as the glycemic load. So glycemic index multiplied by the portion of that carbohydrate is glycemic load. And the lowering of glycemic index or lowering of glycemic load is paramount, and so whole grain legumes should be given.
All right, Dr. Agrawal, yes, I think I understood, all the terms there, but very important to keep in mind when planning your diet as well, and a very important issue. Thank you so much, doctors, for talking to us and answering all those questions about pre-diabetes. That is clearly a condition that more people need to be aware of, especially since it gives you some time for making certain changes so you don't develop a full-blown diabetes. Thank you for joining us, and thank you all for watching at home. Goodbye.